Chapter 10, the cardiovascular and lymphatic system. So I could spend an hour talking to you all about each system. So we don't have time for a 2 hour lecture. However, you're welcome to ask me any questions. I'm going to give you a very brief, summarized overview of these two systems. So the cardiovascular system delivers oxygen, nutrients, hormones, and other important substances to our cells, organs throughout the entire body. The system is made up of the heart and blood vessels. Just to break it on down in simple terms, that is what your cardiovascular system is made of. The heart being the main organ, and then you have large vessels. Now, again, this is not an anatomy course. There's a lot of anatomy in both of these systems. Review the book, review the PowerPoints, be familiar with, what the heart looks like, the different components, what have you, and that's I guess that's my expectation for you all. And of course, the terminology. We'll get into that in just a second. So the heart is located, of course, between the lungs. There's an endocardium, myocardium, epicardium that protects the heart. Blood flow through the heart is discussed in the chapter. They do a great job. The visuals are just phenomenal. I've mentioned it before. Websites or applications like Pinterest have different, um, like for nursing school, med school, different resources to learn the heart inside and out if that's what you want to do. You do not have to do that for me for this little 1C or 1 credit course, but just be familiar. I will tell you that, um, what was I going to say? I forgot what I was going to say. It'll come back to me. The book does a good job. I think that's what I was going to say. You don't have to utilize any other applications or resources. This book does a fantastic job with the visuals and the diagrams, etc. Um, okay, so let me go back up here. Let me just make sure there's nothing else that I want to say out loud. Obviously, you all can read blood supply to the myocardium, the heart. Endocarditis is something very common when we have flus or colds or any kind of viral infections that just don't clear well. They don't clear on their own. People can get endocarditis. Just like I mentioned, we were going over neuroencephalitis. Encephalitis is common status post a viral infection. So is endocarditis found in the heart. Okay, an ECG, electrocardiogram. This is similar to an EEG that is used with our the encephalogram. This is so the ECG is the electrocardiogram. It looks for electrical signals to see if they can diagnose if there is a problem on the electrical side of the heart. The heart, yes, the heart is electrical. There's depolarization, repolarization, SA node. This is, I can't get it to go all the way down. I have my screen's a little bit wonky. But on the page, I think it's page 317 in your book, you have an example of a ECG, EKG, ECG showing where the normal sinus rhythm is. So yeah, review that. Vascular system contains our arteries, capillaries, and veins. Your book mentions arterioles and venals. Now, I have to say, in my 27 years of nursing, I've never said that out loud, like, describing anything or doing education to a patient. So, arteries, capillaries, veins are the most common terms we hear with vascular systems. The vascular system moves the oxygenated and fluids and such through the body. Deoxygenated blood get it to the right place, and you reoxygenate it, etc. Blood pressure is now I could do an entire 3 hour lecture on blood pressure. The biggest thing to know about blood pressure is you want it normal. A great blood pressure is 100/60. An okay blood pressure is anything like under 120 systolic and under 100 diastolic. You do not, if your blood pressure is 120/80, you're essentially knocking on high blood pressure. That is not necessarily a good, I'm air quoting, a good blood pressure. A good blood pressure is 100/60. And oh gosh, there's so many factors that have to do with blood pressure. We've got to keep ourselves hydrated. We got to keep ourselves moving. Um, Sphygma, that thing, a blood pressure cuff is what we call this, that measures the blood pressure. And so systolic is the arterial pressure. Diastolic is that's the measurement when that pressure sound disappears. So this is kind of when your heart's at rest. This is when it's really working, like your heart beats to push that blood. And again, the reason why I'm saying this number out loud, I don't want you to think that because you have a blood pressure of 120 over 80, you have good blood pressure. Hear me again. That is not that is borderline high blood pressure. 100 over 60 is good blood pressure. 110 over 70 is still good blood pressure. But if you or someone you love has blood pressure of 120 over 80, they need to make some changes in their lifestyle, whether it is moving more, eating less sodium, eating better in general, quit eating, the foods from the middle of the grocery store, stay along the outer edges to find more whole foods and such as that. Again, that's a whole nother lecture I could give you all on blood pressure. So let's stick to terminology. The cardiovascular system, you have an aorta, aortic valve, apex, arteries, arterial, or I guess I should say arteriole, atrioventricular, the AV node, atrium, AV bundles. So yes, this list goes on in your textbook. Just be familiar with those words, the terminology, root words, cardio, you've seen this before. Artery, atrium, ventriculo, valvo, refer to myocardiopathy. Okay, fine. Exercise, do these exercises, you all. The answers are right there in your book. Test yourself. Again, say these words out loud. Root words for blood vessels: vaso, vasculo, arterial, or aorta. Aorta is, we have a lot of aorta aneurysms. Sometimes we even have abdominal aneurysms where that big superior vena cava or one of those large vessels starts to swell inside of the vessel, kind of like a aneurysm, a blood aneurysm, um, aneurysm, but you can have it in the brain. That's what I was trying to say. Another exercise on that page. Clinical aspects of cardiovascular atherosclerosis, which most common form is arteriosclerosis, so within the vessels. This is when you have fatty things in your bloodstream. Again, change your diet, move more. Thrombosis and embolism, these are never good. Some of them can resolve on their own, but we've got to take care of our bodies. They were designed to eat better than what we currently do as a society in the United States and to move way more. Think back to 1,000 years ago, or whatever timeline you want to go, 3,000 years ago, to how people obtained food and ate and what it did to their body. So here's a section about aneurysms. You can read about that. Hypertension, heart disease. This is it's a huge prevalent issue along with cancer here in this part of our nation because we are in the South and we like to fry things and we like to drink the extra sugars and so many things that correlate with hypertension and heart disease, but especially here in the South. But other places of the country and even the world, blue zones are considered like healthy societal eating habits. There's some controversy behind that, though, if that's accurate. But anyway, okay. So again, I could talk so much about every one of these paragraphs, and I don't have that much time. A myocardial infarction is a heart attack. So many reasons that this happens. Some of this can be hereditary. A lot of folks who are just strict vegetarians, believe it or not, they're more susceptible to heart attacks than some of our fat-loving meat eater, eating real butter, eating whole foods folks, just because the vegetarian lifestyle requires you to eat a lot of processed foods. Again, there's so much information, there's so much data out there about this. But we always want to try to do our best to prevent heart attacks. A great way to do that right now, no matter what type of diet you eat, is every time you eat a meal, get up and walk for 15, 20 minutes afterwards. That's it. Just go walk. Go walk. Go take a dog or a pet outside. Go, so many things. Go walk to the mailbox. Go to a park. Go, just get up and walk. Okay, what was that one? Arrhythmia. Arrhythmia occurs when there is just an abnormal heart rhythm. This can come from dehydration. This can come from drugs. This can come from too much caffeine, and arrhythmia can occur many ways. By the way, I don't know if I've said this in this course before. Do not drink energy drinks. Do not. It impacts your heart in horrible, horrible ways, much less the artificial chemicals you're putting in your body and so many other things. But the heart is significantly impacted by energy drinks because you're not supposed to, they're not real. It's just not, our body's not designed for that. All right, fibrillation, yes, that's a different arrhythmia. Congenital heart disease, like I said, some things are genetic. You're born with things that can be fixed. Some things cannot. Disorders of the veins, you can read about that. Vascular technologist, this is a great health path, if you will, program path, a health path in a healthcare career. Especially here in the South. There's a lot of job security there. A lot of cardiologists come from all over the world and move to the South, the southern states with great medicine because that's where the patients are, right? Okay, so more terminology. I'm just rolling down this list. Again, the book already does a fabulous job. Okay, the lymphatic system. I got to do this in like 4 minutes. All right, the lymphatic system, it manages fluid levels in our body. It reacts to bacteria that's introduced into our body, whether it is in the form of um, a sliced finger or bacterial meningitis or what have you. It also, our lymphatic system deals with cell products related to disease. It can deal with cancer cells, and it even absorbs some fats in our diet. The lymphatic system is made up of lymph nodes, lymphatic ducts, all sorts of things. Read about that. Again, great illustrations in this book. The thymus, the spleen, the appendix, yes, they're all part of Payer patches. Terminology, appendix, lymph node, lymphatic system, read about that. So here are our root words related to the lymphatic system. Lymph, spleen, thyme, tonsil. Yes, tonsils are also part of the lymphatic system. That's, you get tonsillitis or you get swollen tonsils because your lymphatic system is working its best to get rid of those germs inside your throat, maybe ears, nose, etc. Clinical aspects, hang on, lymphadenitis, lymphangitis, lymphedema, lymphoma. Read about those. Lymphoma is a cancer, it's a neoplastic disease involving the lymph nodes, and there's different stages. Lymphedema, when lymph stops flowing. Lymphedema, this in women who have mastectomies and they remove all that breast tissue, which are, by the way, breast tissue in men and women are full of lymph nodes, lymph material. So if you have a mastectomy, man or woman, I should say, you can oftentimes experience that lymphedema in your hands, your arms, because you no longer have those lymph nodes picking up that fluid. Lymphangitis, yes, all those terminology words I just shared there. So here's an example of some lymphedema. The left arm and the right arm look vastly different, and it can be for multiple reasons. Terminology, pulse pressure, stroke volume, Valsalva maneuver, cardiac tamponade, ectopic beat, etc. Review those words and just be familiar with the meanings oh, that's it, and where to find them. And I'm at 13 minutes. Okay, so fabulous. As you review this, oh, here's an example. This is pitting edema. Pitting edema occurs for multiple reasons. It can occur during pregnancy, for a young, healthy patient. It can occur in our elderly who sit and dangle their feet way too much. It can occur in a normal age, normal health status person if you don't drink enough fluid. We have to drink water. And let me say, I just said enough fluid. I meant water. If you constantly drink sodas, if you're constantly drinking juice, we don't drink energy drinks anymore after I just said that. But those type of fluids are not good for you. Our body needs good water intake. Okay, so I have talked enough about cardiovascular and the lymphatic system. As you review, again, uh, if you don't prefer my lectures, that's totally okay. YouTube offers so many lectures on these chapters, or not, I shouldn't say these chapters, but on these topics. Instagram, the application, you can just type in cardiovascular system and all sorts of things will come up. And same thing with Pinterest. And I'm sure I don't use TikTok, but again, there's other ways to get information if you need to hear it. read it differently if the textbook is just not serving you well, but this is what we go by. So anyway, hope y'all have a great week.